Hi, I'm Casey, and I'm a certified hand therapist. I've been a therapist for over 13 years, and I've treated thousands of patients with pain in their hand, wrist, elbow, and even shoulder. I'm here to help. I'm your hand coach. As a mom of two and a hand therapist, I have an insider's look of what it truly means to have mommy's thumb or Dequarvian's tendonitis. In this video, we will be discussing Dequarvian's tendonitis, what it is, what causes it, and what you can do about it at home. Dequarvian's tendonitis is an inflammation of two very specific tendons in the wrist and thumb. These two tendons work together to bring your thumb out and up. The first tendon is called your extensor pollicis brevis. It inserts just past the MP joint of your thumb, extending your thumb into extension. The other tendon is called your abductor pollicis longus. It brings your thumb out as if you're going to reach out and grab or pick up an item. In an effort to hold these tendons close to your wrist, your body created an extensor retinaculum to hold the tendons real close to the bone. The extensor retinaculum is a dense piece of connective tissue acting as a pulley. When the tendons run underneath the extensor retinaculum, it creates a shear force rubbing back and forth as the thumb moves out and up against gravity. Just like two pieces of wood rubbing against each other, this shear force creates friction and heat. We call this inflammation or tendonitis. More importantly to you, we identify this as Dequarvian's, otherwise known as mommy's thumb. Dequarvian's was first identified by Dr. Dequarvian. It was otherwise known as washerwoman syndrome. It gets its name from people doing repetitive work, either washing clothes on a washboard, picking up large piles of dirt or rock. It can be from pouring large volumes of fluids, scraping paint or even painting a fence, hammering or using power tools, stirring or using a whisk in the kitchen, repetitively washing dishes, washing tables, windows, or other surfaces, or having poor ergonomics at home or work. But hands down, the number one place I see this develop is in new moms, when they go to pick up young babies or even pet owners that are picking up a small puppy or a new rabbit, things like that. They come and pick those babies or rabbits up like this in this motion, causing pain to happen because of the repetitive motion that they're creating. When a new baby is born, she doesn't weigh much. But as the months go on, babies start to gain weight. What used to be tolerable for the wrist and thumb no longer become tolerable, and the weight of the baby starts to outpace the abilities of the thumb and wrist tendons. These habits and activities start to become more and more painful. They can be normal movements, as in picking up babies, or awkward, strange angles coming in to hold the head of a new infant up. In addition to holding the weight of the infant, the parent often finds themselves in weird, awkward positions, using contraptions getting in and out of cars. In addition to this, moms find that positions of nursing or positions of pumping require the wrist and thumb to be in awkward positions, sometimes in excess of 20 to 30 minutes or so. Really, anything that you do that brings your thumb out in this direction and your wrist up in this direction puts you at greater risk. That's Dequarvian's. If you want to learn more, please visit my website. I hope you've learned a few things. Until next time, I'm Casey, and I have been your hand coach.